Good evening, respected professor, my dear students. I welcome you to the RAISA online academic activities on Webex platform today. Today we have 7 interesting questions for theory discussion. Over to professor and students, please.
I think we'll first finish up the last week left out questions on oxygen analyzers and depth of anesthesia, and then go to the
Yes, sir.
present. You are presenting, Abirami?
Yes, sir. Yes, sir. Good evening, sir.
Good evening. Go ahead.
My topic is oxygen analyzer, sir. Oxygen analyzer recommended for all anesthesia cases to measure oxygen concentration in medical gases to prevent hypoxia. Incorporated in anesthesia workstation, either at common gas outlet or inspiratory limb of the circuit system. Importance of O2 analyzer. Accurate O2 monitoring essential for patient safety. It is essential to support vital organs for maintaining oxygen. Support vital organs. In case of insufficiency, can lead to hypoxia. Type of oxygen analyzers: paramagnetic oxygen analyzer, galvanic oxygen analyzer, and polarographic oxygen analyzer. And other types: mass spectrometry, Raman spectrograph, etc. Now, paramagnetic O2 analyzer is the most commonly used. Analyzer circuit consists of two chambers separated by pressure transducer. The sampling chamber receives a sample gas containing O2, and reference chamber receives a room air delivered to other chamber. Oxygen molecules have unpaired electron in its outer ring, which make it paramagnetic and attracted in magnetic field. This forms the working principle. The device sample gas from breathing circuit should be close to the patient. It uses switched electromagnetic field generated at 110 Hz. Changing magnetic field created by electromagnet, which rapidly switches on and off, causes O2 molecule to be attracted and agitated, lead to changes in pressure on both sides of the transducer. This pressure difference across the transducer is proportional to the oxygen partial pressure difference between the sample and reference gases. This transducer converts this pressure force to electrical signal displayed as oxygen, partial pressure of oxygen. Modern analyzer use both inspired and expired oxygen concentration. Audible alarm set for low or high concentration limits. It is affected by water vapor, water trap incorporated in this device. Next type is galvanic O2 analyzer, also called fuel cell or Herschel analyzer. The works on the principle of chemical phenomenon generated by O2 molecule. Consists of a noble metal cathode and lead anode in a potassium hydroxide solution. This O2 permeable membrane separates a cell from gases in the breathing system. O2 molecule diffuses through the electrochemical sensor membrane and electrolyte solution to a gold cathode, generating an electric current proportional to the partial pressure of oxygen. It reaches either inspiratory or expiratory O2 concentration. It is positioned at the inspiratory limb of the circle system. Water vapor does not affect its performance because its action is inside the cell. It is depleted by continuous exposure to oxygen exhaustion of the cell. Because of oxygen exhaustion of the cell, so lifespan is limited to 1 year. It has slow response time of 20 seconds. Next method, polarographic or Clark electrode or O2 electrode analyzer. It has similar principle like galvanic O2 analyzer. The O2 molecules move across the Teflon membrane and current flows between silver anode and platinum cathode. The current generator is proportional to the O2 concentration of the sample gas. It is also attached to the inspiratory limb of the circuit. A lifespan is 3 years because of deterioration of the Teflon membrane. Gives only one reading, an average of inspiratory and expiratory concentrations. Other types, fluorescent O2 analyzer or laser-based O2 analyzers also used. That's it, sir.
Okay. So, as you rightly said, oxygen analyzers are part of the workstations nowadays.
Yes,
they
sir.
give you the concentration of oxygen both in the inspired gases as well as in the expired gases.
Yes, sir.
Why should it be measured in the expired gases?
Expiratory concentration.
Why do you want to? When is it useful? Are you going to exhale oxygen every time when you are exhaled breath?
No, sir.
Then what is the purpose of having an analyzer in the atrial blood?
During pre-oxygenation.
Fantastic. To see whether there is a adequate pre-oxygenation. If you get 100% oxygenation in the exhaled air also, that means you have completely removed the room air from the respiratory tract.
Yes,
Okay?
sir.
So that is the main purpose of the exhaled air oxygen concentration measurement.
Okay, sir.
Right,
Yes, sir.
very good. That is one question. Can be asked which you can to answer. The second question is you mentioned about the polarographic principle, where
Yes, sir.
the oxygen is attracted towards a magnetic field, and there is a sample chamber and a reference chamber, and depending upon the partial pressure of your oxygen,
Yes, sir.
the pressure difference occurs, and which is converted into electrical signals to display the percentage.
Yes,
Do
sir.
you have any similar instrument which is used in your anesthesia machine, where a differential pressure transducer is used?
ETCO2.
ETCO2, you don't have that. You have a sampling chamber, it goes directly to the measurement.
Pressure transducer.
Hmm? Any vaporizer has this principle?
Yes, sir.
Which one?
Take.
Desflurane vaporizer, the vapor is heated up in
Yes,
a
sir.
separate chamber, and it comes out with a pressure. And
Mm.
if there's no fresh gas flow enters the vaporization chamber of the, so it is more or less like a injector. So
Yes,
there
sir.
also they use the differential pressure transducer to adjust the concentration or percentage that you want. Okay?
Yes, sir.
So that is the second one. And have you ever seen which one is commonly used in the workstation, polarographic or fuel cell or your galvanic?
Paramagnetic. Paramagnetic.
Is it the one used in the anesthesia workstation, paramagnetic?
But most commonly paramagnetic is used.
Have you ever seen paramagnetic? Have you ever opened the oxygen analyzer in your machine and seen? Anyone shown you?
Galvanic cell, sir.
This is cell fuel cell, galvanic type. Okay,
Sir.
it is not the polarographic or the. And where is the Clark's electrode used? Is it used in your anesthesia machine?
Yes, sir.
Yes, sir. Soundarya, Clark's electrode used in anesthesia machines. Hiranmayi is also there. Hiranmayi, it's Clark's electrode used in anesthesia machine or some other machine.
No, sir.
Clark's electrode is used in ABG machine, arterial blood gas analysis machine. Okay, that is also oxygen analyzer. It is not necessary that oxygen analyzer should be there only in anesthesia machine. It is there used in anesthesia blood gas measurement also. Okay.
Yes, sir.
So these are some of the points that you have to remember.
Yes,
I'll
sir.
just share my screen with you.